Anxiety is an intense, excessive, and persistent worry and fear in everyday situations. Anxiety is a normal and often healthy emotion, but when people feel disproportionate levels of anxiety, it can become a medical disorder. Anxiety disorders form a category of mental illnesses that lead to excessive nervousness, fear, apprehension, and worry. These disorders alter how a person processes emotions and behaves. Mild anxiety can be vague and unsettling, while severe anxiety can interfere with day-to-day life. Anxiety disorders affect 40 million people in the United States, and it is the most common mental health disorder in the country. Surprisingly, only 36.9% of people who have an anxiety disorder actually receive treatment for it. MedicalNewsToday.com, 2018. Researchers are finding that both genetic and environmental factors contribute to the risk of developing an anxiety disorder. Some of those risk factors include temperamental traits of shyness or behavioral inhibition in childhood, exposure to stressful or negative life-changing events in adulthood or childhood, a history of anxiety or mental illness and biological relatives, and some physical health conditions such as thyroid problems or heart arrhythmias. Caffeine, other substances or medicines can aggravate anxiety symptoms. National Institute of Mental Health.gov, 2018. There are several ways anxiety can be treated. Anxiety disorders are typically treated with psychotherapy, medication, or a combination of both. Psychotherapy is also known as talk therapy. To be effective, it must be directed to the person's specific anxiety and to their specific needs. Cognitive behavioral therapy is the most common type of psychotherapy used today. It teaches people different ways of thinking, behaving, and reacting to anxiety-producing situations. Medication is another type of way anxiety is treated. The most common classes of medications used to combat anxiety disorders are beta blockers, benzodiazepines, and antidepressants. MedicalNewsToday.com, 2018. Medication cannot cure anxiety, but it can help reduce symptoms greatly. Certain substances, such as caffeine, some over-the-counter cold medicine, illicit drugs, and herbal supplements, can aggravate anxiety symptoms and counteract prescribed medications. Patients should talk with their physicians to make sure that they know which substances are safe and which substances they should avoid. Some people choose to self-medicate their anxiety by becoming active. Running, yoga, and working out are just a few examples of some ways people are using to treat their anxiety. All of these have been proven to work, but it's important for each individual to find out what works best for them. I have suffered from anxiety for over 15 years. There were times in my life where it was debilitating. I missed out on a lot of opportunities because of my anxiety. Throughout the years, I've been placed on many different medications before I found one that I thought worked best for me. I also did my own research and found that decreasing my caffeine intake, increasing the amount of rest that I got daily, and working out were all ways that helped me cope with my anxiety disorder. It's very important for each individual to recognize and understand how severe their anxiety disorder is before a treatment plan is established and put into place. Anxiety disorders are a real serious medical condition, just as serious as physical health conditions like diabetes and heart disease. As you can see, in conclusion, most people will experience some sort of anxiety throughout their life. A normal and healthy type of anxiety would be nervousness or anxiety before a big test, a presentation, or even a first date. Anxiety disorders, however, are illnesses that cause people to feel frightened, distressed, or uneasy for no apparent reason, and those left untreated can dramatically reduce productivity and significantly diminish an individual's quality of life.